Friends, so excited to invite our guest today. Natalie Davis is the co-founder and CEO of United States of Care. That's United States of Care. She has nearly 2 decades of experience shaping health care policy, including serving at the Centers for Medicare and Medicaid during the rollout of the historic coverage expansions. She was recently recognized as one of Washingtonian's 500 most influential people of 2025. Natalie, what a pleasure to have you here this morning.
Thank you so much for having me.
I Let's just jump in. So, what is United States of Care? What's the big idea behind it that you believe is helping to transform healthcare delivery in the U.S.?
Great. So, United States of Care is an advocacy organization. We bring the voice of people to the halls of power all across the country. So, in states, to the administration, to Congress, regardless of who's in power. And what makes us unique is that we actually go out and talk to people. We talk to people across the country, and really that core belief that we have is that all of us want the same thing out of the healthcare system. We have the same experiences often, the same language, the same needs for what might change, but politics often gets in the way of showing where people agree. And so our passion, our belief is that we go out and talk to people across the country to really find those shared experiences across demographics and use that to shape the healthcare system, the policy that we work on to build what people want.
I have to say, for folks who are listening, uh, their website, United States of Care, I would look it up. I spent so much time on it. It was so easy to read. You took complex issues and made them so simple, so straightforward. I was envious. I was jealous. As
Um,
someone who considers themselves a communicator, you blew me away. You and your folks did a great job. I literally could not get off it. I was so enthralled with it and learned so much. One of the things I learned though was you have this listening research, and I never heard that term, listening research. I love that.
Yeah, well, good. I'm glad. And it's been years in the making. And when we first brought this to the board, when we launched the organization, I was building out our community engagement strategy because we had a belief we needed to prove that people agreed on what they wanted the healthcare system. And so it was like, how are we going to do that? And I went to the board and I was like, we're going to listen to people. And they were like, what are you talking about? But it is that we go out, like I said, and we talk to people all across the country and engage them in different ways. We've now engaged over 30,000 people across all demographics, every state, and have a data warehouse now of over 115 unique data sets that are really mapping the human experience in the American healthcare system. And there are differences, and there are really important differences when we think about demographics. And we, again, are looking for those shared needs, shared language that people use, shared emotions that they have. Because in our country, I don't think people see themselves often in the policies that are passed. Um, they don't feel maybe that they're getting the right issues, that they're going to feel it in their pocketbooks and in their family and in their health. And so we are really making that direct line into listening and then using that to change policy. And part of changing policy is putting the emotions and feelings around it. So when our policymakers or our leaders are out there talking about it, we, as the people listening, can feel that emotional resonance as well as the solution really will make our difference. So we have a mixed methods approach. I'm happy to wonk out and go geeky on that, but it is really awesome. And we have no ambitions to stop. We want to continue to talk to people across this country.
You do have a point of view, and I loved the way you have four clear goals,
Mm.
and within that you had these 12
Mhm.
solutions. And I was just wondering if you could quickly just what are the four goals?
Yeah, and look, these are built after talking to people across the country. So we use them as our North Star, but we didn't come up with them in a vacuum. And that really is indicative of how we like to use a people-centered design approach. So when we talk to people, we ask them all sorts of different questions. And I can tell you like the first five questions we always ask everybody. And
Hmm.
really it's what you're talking about, United Solutions for Care, is after hearing from people and really understanding through a mixed methods approach, what is the healthcare system that would meet their needs? Um, And the four clear goals that came out again across demographics. Number one is people have the certainty they can afford their health care. And the word certainty there is doing a lot of work, as I talked about capturing people's emotions. We could have said people can afford their health care, but when you talk to people or you even think about your own experiences, that uncertainty about affordability is a huge mental load that people carry or makes them avoid care, et cetera. So, number one, people have the certainty they can afford their health care. Number two, people have dependable coverage as their life changes. Right
Mm,
now, people feel like if they get sick, if they get cancer, pregnant, hit by a bus, lose their job in a pandemic, they lose their insurance, right?
mm,
And it's true. And so they want coverage that's there as their life changes. Number three, people want personalized care, which to them means what and where and how.
mm,
Care in the community, care for their full bodies, their mental and physical are seen as the same, and really meeting them where they are. And then number four, people want a healthcare system that's easy to navigate and understand. And usually that's like where people laugh because it maybe feels like the one that's hardest to get is a
right,
system that's easily to understand, but it
right.
is so complicated and it really infuriates people. It really confuses them. It makes them feel like the system's not there for them and it wasn't designed around them.
There are lots of advocacy groups around, lots of policy groups around, and I suspect most people like myself, it's just white noise. Okay, there's another group in DC, blah, blah, blah. I came away from your website with a very, very different appreciation.
Mhm.
Why is United States of Care and other groups that are similar to yours, why are they important in the ecosystem of healthcare?
Yeah. Oh, I love that question. Um, United States of Care and our ability to go out and listen to people and find common ground is important because the voice of the patient, and that sounds cliche, which is sad to say, but the voice of us people are not at the table where decisions are made. And as the saying goes in Washington, if you're not on the table, you're on the menu. Um, we need people at the table, and there's lots of different ways to do that. And for us, it meant showing that there's common ground. When you're in Washington,
Mm,
D.C., or you're in other state capitals, we make it sound like nobody agrees on anything. And there are places perhaps that is true. I
mm,
believe in humans, period. I believe in goodness of people. And I believe people don't feel listened to. And I don't feel like they feel like leaders are taking up the issues they want in a way they want with their needs in mind. There's
mm,
so much noise around industry, political interests, all sorts of things that muddy the water. And so for us to be able to say clearly, here's what people want, we have the data to show it. This is not lipstick on a pig where we're putting language around a bad policy idea and really showing there is a new way to do policy. I mean, we created this in healthcare. I firmly believed our model can be taken to climate, can be taken to education, can be taken to infrastructure. It is about talking to people across this country, showing democracy works, and building that into policy. And so I think it's something missing, and I think that people feel that even if our methodology is unique, I think people really, when we talk to people out in rural South Carolina and rural Maine and Colorado,
mm,
feel really appreciated being heard,
mm,
really appreciate it. And not only if they're in a group setting, they're hearing from other people and they're seeing their neighbors are feeling the same things and going through the same things. And one of the
mm,
kind of findings that I've had and I've sat with over time is often I would talk to people and ask them some questions, and they'd say, Natalie, I'm happy to tell you, but like I'm unique. My story's unique, and I'm bad at healthcare. I'm either too rich or I'm too poor. I'm too unhealthy. I'm too healthy. I'm too rural. I'm too city. I suck at healthcare.
mm,
And then I would hang up and I'd call somebody else and they would tell me something similar. And what it
mm,
meant to me is that people we're not seeing this as a systemic issue of the system failing them, but them not picking the right insurance, not picking the right doctor, not staying on their diet, not staying on their medication. And so for me, I actually think there's a change happening. I think people, and with
mm,
the murder of the United CEO and people cheering for that, I mean, I think
mm.
that's a cultural moment that we need to really sit with and see that people are really mad
Yes.
and really need to change
Yeah.
things.
Yeah.
And so, long story short, that's why we're unique and why we started the organization. And
Yeah.
it's fascinating and to do
Yeah.
this.
Let's jump into
Yeah.
how you do it. You mentioned the methodology a number of times. Can you walk us through that, but can you use an example like your patient
Yeah.
first or yeah.
Yeah, I'm happy to talk about patient first care because it is the one that I love talking about and has probably gotten the most interest, actually,
Mm,
especially for folks in the private sector, because it's about value-based care, right? This is a concept we've been talking about for for over a decade in this country, and really seen that as a way to deliver healthcare differently and save the government money, and incentivize doctors to care differently. And so we realized that there was little their political support was starting to wane in Washington because all the champions that built that during the ACA, the thing that stayed bipartisan, the staff that were there aren't there.
mm,
And it's a wonky concept. It's people go in and talk about risk adjustment and this
hmm.
and it's a lot. And
Right.
so we thought if we're going to teach new members about this important issue, let's do
Mm,
it in words that matter to their voters, right? So they can talk back to their voters about what they're working on and why it matters. So
mm,
our methodology was to go out first and talk to people about, and we did this in communities, we did it in focus groups, and which are a little bit more scientific. And we would talk about this other way of doing healthcare. We never mentioned the word value-based care. We would say, actually, first we would say, what are the things you hate about the current healthcare system? We assume that they're in some sort of fee-for-service experience. So what is it that you don't like? And then we have all that. We've been able to do the data to like really show the same, the commonalities.
hmm.
And then we said there's this new way of doing healthcare, and here's some of the promises of that delivery of care. Some of it's doctors get paid more. Some of it's, saving money for the federal government or the Medicaid, the Medicare trust fund, all the way to coordinating your care and da 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 da. So we put that in front of people. We had people talk about it. We had people circle stuff that was emotionally resonant, really give their experiences with it. Again, we're able to show like here are the things that matter most to people in the new promises of value-based care, which I can tell you more about. But then we said, okay, actually, this is real. This is a thing. These are policies, and it's called value-based care. Like, what do
Mm,
you think? It was the worst performing message we've ever done because people think of the word
yes.
value as
Right.
cheap.
Right.
It plays into their insecurities that they already have of someone else decided I need something cheap, and now they're going to convince me to get it. So not only do they think they're getting cheap healthcare, but they also feel a little bit played, a little bit used, and plays into this a real fear that people have is that someone's making money off my back. So they're saving money so someone else can make money.
Yeah.
Um, and it just didn't resonate. It just and whose values? Someone else making a value judgment. And so we said, well, what would you call it? And they came up with patient first care.
Mm,
And so that's what we use, and we've already started using that in other ways to really show what people want because it's not just about a new way of paying for healthcare. The things that they want are experiences. Number one is they want more time with their doctor, less time
mm,
in the waiting room, less time coordinating their own care and telling their story to multiple doctors. They want to be seen as a full body where their mental health and physical health are seen as one thing, and maybe their back pain is because they're depressed. And so they want that. They want to get at the root cause. They feel like I know that they are given surgeries or scans or medication that aren't actually getting to the root
mm,
of what they want changed. And that, by the way, also plays in their insecurity that someone's making money off of it. And they're given this surgery because the surgeon's making more money. And so these sort of concepts, it's really interesting when
mm,
you start talking to people about healthcare. They do talk about, they want to be healthy, but they mostly, because the experience is so bad, they
mhm.
talk about the experiences of healthcare.
Right. Right.
Also, often in healthcare, we're like, well, what are the outcomes? And the, that is certainly there, but so much of it is about the experience.
Interesting. And so now you have this information. What's the next step in your
Yeah,
process?
so we've distilled that into those findings, and like you said, you can find that on United States of Care. We then map that to because our team is they're listeners, but we also have some wicked smart political prowess and policy expertise, and so mapping that to what are policy principles
Mm,
from those findings. What are some actual policies that
mm,
principles that
mm,
as people are building value-based care companies, as they're building policy, here's what people want. We use that and a messaging guide to say this, not this, very clearly, to educate new policymakers and advocates across the country. It is a confusing conversation, like I said, or confusing topic. And so helping them realize when they work on something on patient first care,
Hmm.
and they have a constituent that comes up and says,
Right.
healthcare is broken. My doctor won't see me or listen to me. They can say, you know what, I know. We're working on patient first care. And if you are on dialysis, you're gonna have a new way of getting health care. Like so just connecting those dots.
So Natalie, it's
Yeah.
really, from just a very simple perspective, it is really figuring out what people need, and then honing the language
Yeah.
that makes sense to people and appeals to people and doesn't trigger them with kind of words, and then creating talking points. So it's really about communicating and teaching
That's
and
one part.
messaging.
Yeah. That's
And
right.
then what happens after that? So
Yeah,
you've got that.
that's one part, and we believe that's necessary to prime the path for policy change, right? Like
Right.
if the zeitgeist isn't, if you're not passing policy that doesn't match the zeitgeist or the language of your voters
Yeah.
or policymakers, you can't. It's hard to pass. Um, and then we turn that into policy and advocacy. So, working with the Biden administration, the Trump administration, the folks that are working on quote unquote value-based care and helping them understand as they build new models, as they refine value-based care models, here are principles that they should be. We're in there helping them think about how they can rethink or redesign some of those to match people. Like you said, we're working with states on the ahead model and making sure that those are implemented. In our other work on affordability, we are out there passing legislation.
Hmm.
For a young organization, we've passed 12 bills in states across the country. Just last year, we've impacted over 15 million people's lives, and that is on the ground doing the hard work with community advocates and community leaders and
Hmm.
governors and legislators to really pass legislation that we know will make a difference in people's lives.
How can people learn more? Is it
Yeah.
and even more to the point, how can people become engaged in the work you're doing? Because again, so many of us, I mean, this is real life. This is what's happening today. So many people I know in healthcare are jaded. They're just heads down, just either advocating for their own little territorial piece of the pie,
Yeah.
or they've given up.
Yeah.
And to your point, I can't begin to tell you how many friends and colleagues and people I meet and talk to, and they literally have given up. They can't, they feel the system is broken beyond repair. Their experiences, to your point, are just so frustrating. And again, I want to be very clear. This is not a critique or criticism of the doctors or nurses or PAs or
Absolutely.
MPs or staff or administrators. The people are not the issue. It's the
Yeah.
system.
It's a
And
system.
yeah, but how can people learn more, become engaged?
Yeah, thank you. So you can, like you said, you can go to unitedstatesofcare.org and learn more about the organization. There's a button there where you can get our newsletter. I like to say it's an award-winning newsletter, even though it's won no awards. I think it should.
I
Uh,
love it.
yeah.
It's called Intersections.
The industry, yeah. So there's
Yeah.
the checkup is a news letter that will come to your inbox every 2 weeks, and I promise you, it won't feel spammy. It has digest of what's happening in the news, what our research that's coming out, policy that's coming out. So you can sign up for the checkup, which is our
Hmm. The
newsletter.
checkup.
And
Okay.
the intersection, you're right, is our quarterly kind of digest, which really is looking at the intersection of people, policy, and politics, and diving into a couple of specific areas and really tying that bow together, whether it's affordability or maternal health or patient first care. So there's two great resources that'll come to your inbox. And then you can follow me on LinkedIn, Natalie Davis, or others on our team where we
Hmm.
are, talking about life because all of us who have health have lives, and so we actually think it's really important to round out the story of healthcare with, with our life, and then also, of course, are talking about what's happening in healthcare and resources that we're putting out. So that's the best way to kind of follow along and reach out if there's ways to get engaged. We love. We love partners. We love people that help us spread the word of the
Mhm.
organization. We don't want to be the best kept secret. So any way that we can kind of keep getting our word out there, we'd love to.
I think you just said it. I feel like you are one of the best kept secrets in American healthcare, and I am so glad to be able to reverse that and share that with others. And
Yeah.
I had not signed up for the checkup, your
Yeah.
newsletter. I'm going to sign up for that. And Natalie Davis, thank you and your colleagues for all that you're doing to really improve healthcare for all Americans. Thank you.
Oh, thank you. And thank you for letting me come on and talk about it.